So today we'll be talking about ectopic pregnancies. Hey guys, welcome back to Nicky At Your Cervix. It's your girl Nikki here, and if you're new here, welcome. Don't forget to hit my subscribe button, turn my post notification bell on so you can get an update every time I have a new release. And follow me on Instagram at Nikki_at_your_cervix for lots more interesting content. So, what exactly is this? So usually a fertilized egg attaches itself to the lining of your uterus, but with an ectopic pregnancy, it's also called an extrauterine pregnancy. The fertilized egg basically grows outside of your uterus. So this can involve other areas, like it can grow in your fallopian tube, your ovaries, in your belly, or the lower part of your cervix, which is above the vagina. So it can grow all those other places, but it's not in the uterus. The baby is outside of the uterus. So in more than 90% of the cases, the egg attaches itself in the fallopian tube, and we call that tubal pregnancy. So most ectopic pregnancies are in the fallopian tubes. So what signs and symptoms you may have to suggest that you are indeed having an ectopic pregnancy? So most of the time, an ectopic pregnancy happens within the first week of your pregnancy. So you might not even know that you're pregnant, and you may not even notice any problems. But you can also have some signs that include light vaginal bleeding and pelvic pain, and upset stomach and vomiting, sharp abdominal cramps, pain on one side of the body, dizziness or weakness, pain in the shoulder, the neck, or the rectum. And key thing to note is that an ectopic pregnancy can cause your fallopian tube to burst or rupture, and this is an emergency situation, and the emergent symptoms include major pain with or without severe bleeding. So you may not be bleeding at all, but you have major pain. You need to call your doctor right away. And if you're experiencing heavy vaginal bleeding with lightheadedness, fainting, or shoulder pain, or if you have very severe belly aches, especially on one side, it's an emergency and you need to go and get it checked out with your doctor as soon as possible. So what causes ectopic pregnancy, and what are the risk factors? You may never know why you have an ectopic pregnancy. One cause could be a damaged fallopian tube. So this damaged fallopian tube could keep the fertilized egg from getting inside of your uterus. And some risk factors may include having PID, what we call pelvic inflammatory disease, if you smoke cigarettes, if you're older than 35, if you have sexually transmitted infections, if you have scarring from other pelvic surgery, if you'd had a previous ectopic pregnancy before, if you try to have tubal ligation, that is to get your tubes tied, or if you have tubal ligation reversal. So those can damage the tube, which, as I said before, prevent the egg from going to the uterus. If you use fertility drugs, if you had fertility treatment like IVF, in vitro fertilization. It can also happen if you become pregnant while you have an IUD or an intrauterine device for birth control in. So how is it diagnosed? So your doctor will probably do tests like a pregnancy test and do other pelvic exam, and they might get an ultrasound to look at the uterus and the fallopian tube to see if the baby or the fetus is attached somewhere else. So as in regards to treatment, because the fertilized egg can't survive outside of the uterus, your doctor will need to take it out so you do not have serious health problems. So they can use medication or surgery. So if your fallopian tube hasn't ruptured yet and your pregnancy isn't far along, your doctor can give you a shot of a medication called methotrexate, and basically you get a one-dose injection and it stops the fertilized egg from growing. Your body will absorb the egg in about 4 to 6 weeks. with this treatment, you do not need to remove your fallopian tubes. So it's very important to note that taking methotrexate is not the same as having a medical abortion. So you get a medical abortion when you have a viable pregnancy in which the fertilized egg is attached inside the uterus. This is not the same as that because this egg is not inside the uterus, and the medication for getting a medical abortion is different from this one here. As in regards to surgery, if your fallopian tube was burst or ruptured, you may need surgery, and the most common is a laparoscopy. So your doctor will make a very small cut in your lower belly and insert a thin flexible tube, what we call a laparoscope, to remove the ectopic pregnancy. If your fallopian tube is damaged, they may need to be removed as well. And if you're bleeding a lot or your doctor suspect that your fallopian tube is ruptured, you may need emergency surgery where you get a larger cut, and this one is called a laparotomy. So as in regards to getting pregnant after having an ectopic pregnancy, it might be hard for you to have a typical pregnancy afterwards. So you have to consider talking to your fertility specialist, talk to your OBGYN, and talk to your doctor about trying again. They can discuss the length of time to wait, they can discuss other fertility treatment, as well as your way forward. And that's it for this video. If you have any question, don't forget to drop it in the comment section below. Don't forget to like, comment, share, and subscribe to Nicky at Your Cervix for lots more interesting content. And follow me on Instagram at Nicky_at_your_cervix. Until next time, see you soon. Bye.